What's going on, guys? Spencer here with HM Massage. As massage makes its way over to the Western world, people are starting to realize how much it helps with chronic pain, tension, stress, and all these other ailments that were formerly all just solved by getting pills or going to the doctor. So it's becoming a huge vital role in healthcare, especially now. But there are also some times when massage should not be performed and can actually have a negative impact on the clients. So today we're going to talk about the 7 biggest contraindications of massage therapy, times when you shouldn't do massage therapy, or certain conditions that you should be on the lookout, both as a client and especially as a therapist. Please note that any of these conditions are not aimed to target at people who suffer from these conditions. It's simply to inform the professionals of what you need to be on the lookout for, both for the client's safety and our own safety as a therapist. So let's start off with number 1, a time you should never give someone a massage, and that's if they're coming in intoxicated. Sure, having a couple glasses of wine or getting stoned and then going to get a massage seems like it would be really relaxing. The biggest issue is their body responds differently and their nerves are having a dulled effect due to the drugs. So you could be going extremely deep tissue on these clients and actually hurting them, but they might even say deeper or tell you it's fine because their nerves have been dulled by those drugs. So there's a much higher chance that you hurt them in that session. Number 2 is if somebody has an extremely high fever. This should just be immediately contraindicated because massage is already raising the body temperature due to increased blood flow and physical contact, but you don't know why they have that fever. A body's fever is a natural response to try and kill something that should not be in their body. So their body's actively trying to heal itself. Don't go get a massage. You may make whatever situation they have worse. Therapist, if somebody does come in with an extremely high fever, they feel hot to the touch, if they have any redness or they looked flushed, send them away, tell them to come back a different time. They need to focus on recovery. Third and final one before we get into the good stuff is a contagious flu or any cold. Simply put, for both clients and therapist, if you guys are at home, you're sneezing, you're sniffling, you got snot running down your face, now is not the time to go be in a very close proximity with somebody for an hour. And if you're a therapist and you really want that money, still, no matter who has it, if you have a contagious airborne sickness that's going to get over in a couple days, just stay home, relax, rest, push that massage back a few days. Everybody will live. So those were the big 3 that you should just never massage somebody if they have those symptoms going on. Now we can get into the situation where you can do some massage, but you have to be careful of certain areas. The first being any acute injury or recent surgery. If somebody just recently got a surgery, we're talking within the last 48 hours, or they just recently injured themselves, then it's probably a good idea to avoid that area until you further know what's going on inside their body. Now, I'm not talking about if somebody slept on their neck wrong and their muscle seized up. That is a great situation to come get a massage because that's what we do. But if somebody twisted their ankle outright and it really sprained, it looks really swollen, then you don't want to go poking and prodding on that joint, especially if they haven't passed that acute recovery phase of about 48 to 72 hours. Next up is cuts and open wounds. This one should be obvious. Anytime there is broken skin, that is a passageway for any bacteria, viruses, anything bad to get into our body. And it's a passageway for anything bad inside someone else's body to get out. So anytime you see an open cut, an open wound, anything that you can see is broken skin contact, be sure to avoid that area. And therapists, make sure your hands and your body is also protected. Our skin is our first and primary defense against anything bad getting in, so make sure you don't have little cuts all over your fingers. If you do, make sure to wear bandages, wear gloves, or get new skin and apply that over. There's a lot of different ways to make sure that barrier stays intact. So do it. It's for the client's protection and the therapists. So all of those seem pretty common and straightforward. Next up is these infectious skin diseases, and this is generally what I think of when I think of contraindicated. Most people should know that if you have a horrible cold, stay home. But a lot of these skin diseases can get mixed up, or you're not sure which ones are safe to work on. So here are some of the biggest ones that you should be careful about when it comes to the skin. Psoriasis or psoriatic arthritis is a condition that affects the fingers and toes normally. It leaves a lot of red swollen phalanges, and it kind of gives a silvery scaly border as it begins to heal and break up again. And as psoriasis persists, it starts to affect the joints in the fingers and hands more, and that's where psoriatic arthritis develops. So be careful that if any of the psoriasis is open at the time, be sure to avoid those on clients. Cellulitis, it's a very common skin bacterial infection that leaves a red, swollen area of the skin. It may become hot, may become tender. This is really common, so make sure that if you see a patch of this, be sure to avoid that. Next up, impetigo. This one usually affects kids more, but it can be found in some adults. And this is red, swollen blisters, usually around the face and mouth, that kind of turn to a honey color once they burst. It's pretty obvious what it is when you see it, so make sure not to poke around or touch it. Though if you're not dealing with kids, this one should be less common, but still good to know about. Folliculitis is infected hair follicles, so usually found on the face or head, and you'll see kind of white pustule bumps, almost like big pimples. So be sure not to pop those, and if they are popped or open, be sure to avoid those, especially up in the scalp where they might be hiding amongst thicker hair. Just be on the lookout for any of those infected hair follicles or bumps. Another common is carbuncles. This is usually when hair follicles get infected, but a bunch of different hair follicles get infected, creating a big pocket of kind of pus-filled infection. This infection forms right under the skin, and it's pretty obvious when you see it. It's a big pus-filled pocket. Make sure to avoid that. Probably is pretty tender for the client too, so you don't want to be poking on that. Last two, the first one is erysipelas. Not to be confused with cellulitis, this is another skin rash, but it's much more superficial or to the surface than cellulitis is. This one is going to be a warm, kind of painful rash that's hot, red, could be on the arms, the legs, or the face. Once again, anytime you see a warm, hot, red rash of skin area, just be sure not to massage that. And the final one is necrotizing fasciitis. Basically, anytime you see any condition that seems like it's eating away at the skin, not only should you not massage that, but that client should probably go see a doctor to make sure it does not get any worse and to make sure they get it treated appropriately. And the final time that massage is contraindicated is pregnancy, which is funny because prenatal massage has been proven to have a host of benefits, not only for the mom but for the baby. The only thing to worry about with pregnancy is as the mother is pregnant, her blood pressure is usually increased by up to about 50%. So just be careful with some clients who may be prone to high blood pressure, especially if they're pregnant. That blood pressure is going to go much higher. So just be sure to keep an eye out that everything's feeling okay during their massage. In a majority of these cases, most people aren't going to be coming in anyway. You'd expect most people that they have these conditions. They're probably going to know about them and be on the mend to get them treated. But it's extremely vital to know as health professionals, just in case we do come across those clients, and in case we need to inform those clients that they need to go get something checked out. Thank you so much for watching, guys. Hopefully you enjoyed the video and it helped you out. Give it a thumbs up if you did, and subscribe to the channel for new content every single week. I'll see you guys on the next video. I hope you have a great rest of your day.